In this video today, we're going to talk about scapular pain or pain of the shoulder blade. So it's an uncommon diagnosis. Most people that have it don't have anyone who can help them understand what it is that they're feeling. Sometimes it's a knot, sometimes it's a gnawing pain, sometimes it's burning. But at the end of the day, there are a number of causes for it. And we're going to tell you about those in just a moment. If we haven't met, I'm Dr. Orlando Landrum, a regenerative medicine and interventional pain specialist who helps patients understand their options for pain relief, how to be able to punch pain in the face, and get back to leading life that you deserve. Today, we're talking about scapular pain and giving ideas and understanding about what that means. So, the scapula is comprised of the bone that we commonly refer to as a shoulder blade, right? And pain can be present at the site of that or just inside of that between the areas of the shoulder blade and the spine and the various different muscles and structures that are deeper to it. So there's a number of potential issues and challenges that can be associated with the pain. So first and foremost could be the aspect of the shoulder. When we talk about the shoulder, there's a few different areas within the shoulder that can be a potential issue. The first is something that's called the glenoid labrum. So what the heck does that mean? What that means is the cuff that sits at the shoulder socket that the head of the humerus or the head of the major arm bone sits in. That labrum, which is the cuff, can give referred pain to the shoulder blade and cause some different issues other than just shoulder pain alone. In addition, you have the rotator cuff muscles that also can give referred pain if they happen to have a tear or disruption of some sort. So those are going to be muscles like the supraspinatus, the infraspinatus, teres minor, and subscapularis. So those muscles can give potential problems and issues associated with pain that causes an problem that you would subsequently feel. In addition, you also can have the elements of a bursa that can cause you a problem. And there's three different bursa that are present. One is going to be subacromial and subdeltoid, as well as subscapular. So bursa are collections of fluid-filled sacs that act as natural cushions. However, they can be inflamed and cause different problems, i.e., such as the element of shoulder blade pain. Finally, there also can be glenohumeral ligament disruption. And so those are areas that are ligaments that are connected to the humerus and the glenoid that was mentioned previously. There's a superior, a middle, and inferior ligaments that are associated with that aspect of glenohumeral ligaments, and they can be causes. Some other more esoteric problems and issues that can be associated with scapular pain is you could have a degenerative disc or bulging disc at the site of the thoracic spine. So in the middle of the back, where you can have a nerve being potentially compressed that causes a pinch. You can have pain due to scoliosis, or meaning an angle that's present in the thoracic region. You can have spinal stenosis, which is a narrowing more traditionally of the central canal that can cause pain. And you can also have referred pain from both the thoracic facets and cervical facets. So what the heck is a facet? The facet are the joints that allow for mobility in the spine. So at each segmental level with a vertebral body that connects to another area that has a joint, and that joint can get arthritis in it and cause potential pain. And there are other more less frequent causes that are going to be things like acid reflux, fibromyalgia, shingles, myofascial pain syndrome that can all cause some degree of scapular pain. So you got this problem. What can you do about it? Well, besides figuring out how to be able to maintain good posture, making sure the muscles that connect between the areas of the scapula and the spine, like the rhomboid muscles, have good strength and there's no winging of the scapula and you have no trigger points that are present, exercise, posture, and diet may be able to improve this on its own from a conservative standpoint. But from an interventional standpoint, it's really deducing are some of the referred patterns that we made mention of before a potential cause? Could you have a nerve pain issue from the intercostal nerve, which are the nerves that run in between the ribs that might be giving you referred pain? Or is there something else that is an issue? So In the summary and nutshell, that is what scapular pain is, what causes it, as well as some potential ideas about how to potentially treat it by going after facets, by going after the nerves, possibly the disc, or the muscles if conservative therapy doesn't work. Question of the day. Have you had scapular and shoulder blade pain? Could you always work it out by trying to do a massage or self-directed improvement with a stretch? If so, let us know in the comments. If not, what did you finally do in order to be able to improve that pain? Also let us know in the comments. If topics like this interest you in terms of learning how to be able to get rid of pain without having to be reliant on opioid medicines or other treatments that you just really don't want to do, subscribe to our channel to learn about ways to treat pain, punch it in the face, and get back to leading the life that you deserve. Have a great day.